Greetings and welcome to week three's video lecture. This week we're going to talk about the correct diagnosis codes to describe diseases of the circulatory and respiratory systems. First we'll start with the diseases of the circulatory. The ICD-10-CM has a chapter that's titled Disease of the Circulatory System, which includes code categories I00 to I99. Now this chapter includes a variety of circulatory disease such as rheumatic heart disease, hypertension, and ischemic heart disease. I00 to I02 is acute rheumatic fever. Codes in this subsection correspond with those in categories 390 to 392 of the ICD-9-CM. Conditions included, coded include acute rheumatic pericarditis, myocarditis, and endocarditis, rheumatic fever with or without heart involvement, and rheumatic chorea. I05 to I09, you have the chronic rheumatic heart diseases. Codes in this subsection correspond with those in the categories 393 to 398 of the ICD-9-CM. And conditions coded include numerous disorders related to rheumatic fever. The I10 to I15, hypertensive diseases. These codes in this subsection correspond to 402 to 405 of the ICD-9-CM. And conditions in this category include various hypertensive diseases such as hypertensive heart disease, hypertension with acute renal failure, hypertension with chronic renal failure. I20 to I25 is ischemic heart diseases. These codes in this categories are related to or correspond to 410 to 415 of the ICD-9-CM. And these conditions coded include angina pectoris, myocardial infarction, complications of myocardial infarction, ischemia, cardiomyopathy, atherosclerosis, and atherosclerotic cardiovascular disease. Excuse me. The I26 to I28 is your pulmonary heart disease and diseases of pulmonary circulation. And the codes in this subset correspond with the categories 415 to 417 of the ICD-9-CM. And the conditions that we code in this category include things like pulmonary embolism, pulmonary hypertension, cor pulmonale, arteriovenous fistula, pulmonary artery aneurysm. Then we move to the I30 to I52, which is other forms of heart disease. Codes in this subset will correspond to the 420 to 429 of the ICD-9-CM. And these codes conditions include various forms of pericarditis, cardiomyopathy, heart block, arrhythmias, valve disorders, pericardial effusion, and just plain heart failure. The I60 to I69 is a cerebrovascular diseases. These codes correspond to the 430 and to 434 and 436 to 438 of the ICD-9. Conditions coded include non-traumatic, subarachnoid, subdural, and intracerebral hemorrhage, cerebral infarction, occlusion or stenosis of pre-cerebral arteries, and other diseases and sequelae of the cerebrovascular disease. Now, as you notice, every I code that I'm talking to you about corresponds to codes that are in the ICD-9CM. I-70 I-70 to I-79 are diseases of arteries, arterioles, and capillaries. The codes in this subsection correspond with categories 440 to 449 of the ICD-9CM. And the conditions coded can include atherosclerosis, aneurysm, thrombus, embolus, peripheral vascular disease, and other structures and dissections of these vessels. The I-80 to I-89 is diseases of the veins, lymphatic vessels, and lymph nodes, NEC codes. And in this subsection, they correspond to 451 to 457 and 459 of the ICD-9CM. The conditions that are coded include things like phlebitis, thrombophlebitis, embolism, thrombosis, varicose veins, hemorrhoids, venous insufficiency, vein strictures, lymphangitis, lymphedema, and esophageal varices. I-90 to I-99 is other and unspecified disorders of the circulatory system codes. These correspond to category 458 of the ICD-9CM, and the conditions include hypotension, gangrene, intraoperative and post-procedural complications, and conditions NEC. For guidelines for these codes, for instance, for a patient with chronic renal disease and hypertension, the primary code should be from category I-12, which is hypertensive chronic kidney disease, followed by a secondary code from category N-18 to report the stage of the renal disease. Gestational hypertension is reported with code 013 or 014, depending on the existence of proteinuria. If the documentation reflects elevated blood pressure, but the patient has not been diagnosed with hypertension, you would use R03.0. For reporting angina with existing heart disease, combination codes of I-25.11 and I-25.7 can be used. When a patient's admitted for a cardiac event and there's an existing cardiac disease diagnosis, the acute event should be listed first. So you list the event first, followed by a secondary code for the cardiac disease. If a patient has a cerebral infarction, you use secondary code Z92.82, and we assign that if the patient received tissue plasminogen activator within 24 hours of admission. Okay, diseases of the respiratory. The structures of the respiratory system support the process of breathing and gas exchange across the smaller alveoli of the lungs, those little grape-like clusters at the very base of the lungs. The ICD-10-CM chapter titled Diseases of the Respiratory System include codes categories J00 to J99. J00 to J06 is the acute upper respiratory infections. These codes correspond to categories 460 to 465 of the ICD-9-CM. The conditions coded can include common cold, acute sinusitis, acute pharyngitis, acute laryngitis, acute tracheitis, and acute tonsillitis. J09 to J18, we have influenza and pneumonia. These codes correspond with categories 480 to 488 of the ICD-9-CM. And the conditions coded can include various forms of influenza and pneumonia. J20 to J22 is other acute lower respiratory infections. Codes in this subsection correspond with those in category 466 of the ICD-9-CM. And conditions that we code here are acute bronchitis and acute bronchiolitis. J30 to J39 is other disease of the upper respiratory tract. These codes correspond to 470 to 478 of the ICD-9-CM. The conditions coded include things like chronic obstructive pulmonary disease, sinusitis, rhinitis, and asthma. J40 to J47, we have chronic lower respiratory diseases. These codes correspond with categories 492, 494, and 496 of the ICD-9. Conditions coded are chronic bronchitis, COPD, which is cardiopulmonary disease, cardio obstructive pulmonary disease, asthma, emphysema, and bronchiectasis. J60 to J70 we have lung diseases due to external agents. These codes correspond with categories 500 to 508 of the ICD-9. The conditions coded include pneumoconiosis due to organic and inorganic agents, airway disease due to dust, respiratory conditions caused by inhalation of gases, vapors, fumes, and chemicals, and hypersensitivity pneumonitis. J80 to J84, we have other respiratory diseases principally affecting interstitium. These codes correspond with those in categories 514 and 518 of the ICD-9. Conditions coded include things like acute respiratory distress syndrome, pulmonary edema, interstitial pulmonary diseases, and pulmonary eosinophilia. J85 and J86, or J85 to J86, we have suppurative and necrotic conditions of the lower respiratory tract. These codes correspond with those in categories 510 and 513 of the ICD-9. The conditions coded can include lung abscesses, lung gangrene, and pyothorax. J90 to J94 is other diseases of the pleura. Now these codes correspond with categories 511 through 512 of the ICD-9-CM, and the conditions coded can include things like pleural plaque, pleural effusion, pneumothorax, hemothorax, and hydropneumothorax. J95 is intraoperative and post-procedural complications and disorders of the respiratory system, NEC. Codes here correspond to 519 of ICD-9-CM, and the conditions coded include complications that occur during or after procedures, as well as those NEC. J96 to J99, we have other diseases of the respiratory system. These codes correspond with 517 to 518 of the ICD-9-CM, and the codes include acute respiratory failure, chronic respiratory failure, pulmonary collapse, and bronchospasm, and the interstitial emphysema. Excuse me. Some guidelines, general guidelines actually. When you're reporting conditions from the category J30 to J39, which is other diseases of the upper respiratory tract, you should identify risk factors by listing additional codes such as Z77.22, exposure to environmental tobacco smoke, or Z72.0, tobacco use. You see how that changes just from a disease of the upper respiratory tract. Now we can attribute something to that disease, what causes it, or what enhances that disease, or has enhanced. You should use an additional code for infectious agent when reporting peritonsillar abscess as the first listed code. When you're coding a chronic condition for a patient who has a history of smoking, you should first assign a code for the lung condition, followed by a secondary code of Z87.891, which is personal history of nicotine dependence. For first listed codes from category J95, intraoperative and post-procedural complications and disorders of the respiratory system, NEC, you may need to use additional codes to report adverse effects of anesthesia, the type of pneumonia, type of infection. If a patient's admitted with respiratory condition related to HIV, the code B20, HIV disease, must be reported prior to the code for respiratory condition. Now let's look at an overview of the genitourinary disorders. First thing you want to know is, what does genitourinary mean? It's a word that refers to urinary and genital organs. Urology is the branch of the medicine concerned with the urinary tract in both genders and the genital tract of the reproductive system in males. Nephrology is the branch of medicine concerned with the kidney. Your urinary tract includes organ system primarily for cleaning and filtering the excess fluid and waste materials from the blood. It's made up of these following: kidneys, ureters, bladder, and urethra. And it's exactly the way it goes. It goes from the kidney to the ureters. The ureters takes it to the bladder, and when the bladder's full, it releases it to the urethra. The kidneys also function as glands that produce hormones necessary for building red blood cells and regulating blood pressure. Causes of problems in the urinary system. Well, in children, problems in the urinary system include acute and chronic kidney failure, urinary tract infections, obstructions along the urinary tract, and even abnormalities that are present at birth. Disease of the kidneys often produce temporary and permanent changes to the small functional structures and vessels inside the kidney. Frequent urinary tract infections can cause scarring to the structures, leading to things like renal failure or kidney failure. Some of the diseases that cause kidney damage are glomerulonephritis, hemolytic uremic syndrome, polycystic kidney disease, hydronephrosis, urinary tract infections. Diseases of the urinary tract are often related to a blockage that prevents complete emptying of the bladder and often leads to a reverse flow of urine. A urinary tract obstruction can cause damage to the urinary tract and the kidneys because the urine backs up and it pools in various areas along the tract. The pooling of that urine in the bladder, the ureters, or kidneys can lead to infection and scarring along the kidney, along with long-term kidney failure. Some of the disorders that cause obstruction of the urinary tract are megaureter, posterior urethral valves, ureterosil or ureteral duplication, vesicoureteral reflux, and neurogenic bladder. Now, several disorders of the urinary tract only affect men. These are largely related to the male anatomy as well as fetal development. Disorders that affect males may include or may involve the penis, urethra, or testes. Some of the male disorders include undescended testes, or what we call cryptorchidism. That means that the testicle has not descended or dropped. Hydrocele, hypospadias, inguinal hernia, micropenis, and testicular torsion. I hope this has given you a little view into what we're looking at this week. Please make sure to utilize all of your books. Just looking in one place won't necessarily give you a complete diagnosis. If you have any problems this week, please text me, give me, send out an email to me, or even leave a question in the questions box online. I will get back to you as soon as possible. If I don't know the answer, I will find out the answer to whatever it is you're asking, and we'll go from there. I hope you've had a good week. I look forward to reading your discussions for the following week. Make sure you study and enjoy what's left of the weekend. I'm obviously doing this on Sunday morning, so have a great week. And if you need me, you know how to contact me. Have a good day.